Scientists found a type of chimpanzee in West Africa and found that as the origin of the HIV infection. The earliest case for humans was in 1959 by a man in Kinshasa, Democratic Republic of the Congo. Another article which was published in 2003 by National Geographic News says that HIV originated with monkeys and not chimpanzees. It all started when when humans hunted the chimpanzees for meat. The humans got in contact with the infected blood. The virus slowly moved from Africa to all around the world, and some say that HIV could have came from a single virus from the 1940s. Some say that since chimpanzees eat monkeys, monkeys may have transferred it to chimpanzees. The chimpanzee version of HIV is SIV. HIV attacks the body's immune system. The CD4, also known as T cells, which are supposed to help the body fight off infections, are lessened. When there are less T cells, the body can't fight off infections, and when the immune system is weak. The infections take advantage of the weak immune system. Scientists say that it came from chimpanzees to humans a little before 1931. HIV can spread through many different ways. Primarily, it can spread through body fluids such as semen, vaginal fluid, breast milk, and blood. HIV can spread through sexual contacts, more specifically vaginal, anal, and oral sex. HIV can be spread through needle sharing. Another way to contract HIV is through blood-borne infections, which spread by using other people's needles. When you share needles by a blood transfusion, heroin use, and tattoo needles, you can get HIV. before it was known for gay men to have HIV, but now anyone can have it. If you share the needles or have vaginal, anal, or oral sex with people with HIV, you can contract HIV. Stay safe.
The symptoms of HIV often differ in men and women. For women, in the early stages, you start off feeling like you have the flu. It can take a long time, even years, for the real issues to start to occur. Issues with your skin are very common. It worsens your immune system, so you're more vulnerable to get sick. Then this includes more STDs like gonorrhea and even herpes. HIV makes it very common to have fevers that last for long periods of time. Women will also experience abnormal periods, and their menstrual cycles will go off of their normal times. Patients might also have weight loss, muscle aches, lower stamina, and pain in different joints throughout the body. More severe symptoms for women can include memory loss, confusion, and even going into a coma. Some symptoms can be similar in men, but others can also be different. During the first few weeks with the infection, patient can experience headaches, fever, and other symptoms that occur with other common illnesses. While the virus spreads throughout the body, there will be a pause in the experiencing of symptoms. However, later on, the infection will ruin your immune system, and then you will start getting other diseases easier, like the flu and other STDs. According to the CDC, 1.2 million Americans have HIV, and this is more common in men than it is in women. In the early stages of HIV, 80% of the people who are infected, including men and women, will experience flu-like symptoms within 2 to 4 weeks. HIV is a deadly infection on its own, but it also opens up your body to other infectious diseases, including not only common sicknesses, but other deadly sexually transmitted infections.
Treatment for HIV is still in its developing stages. Scientists are still on the search for a real cure. As of now, there are various methods used to slow down the advancement of HIV. The most commonly used method is called the HAART treatment, HAART, standing for highly active antiretroviral therapy. This method is tailored to slow down the advancement of HIV. Because HIV is a retrovirus, antiretroviral drugs must be used to combat and slow down the progression of the virus. A retrovirus is an RNA strand that inserts a DNA copy of its own genome into the host cell in order to replicate. Typically, several antiretroviral drugs are used together in a combination to form a regimen that is referred to as antiretroviral. These medications are made up of protein inhibitors to prevent the cell from reproducing and infecting new cells. One of the inhibitors is called the NRTI, the nucleotide reverse transcriptase inhibitor. The NRTI is used to force the HIV virus to utilize flawed nucleotides when building so that the virus cannot spread and infect more cells. These medications are made up of protein inhibitors to prevent the cell from reproducing and infecting new cells. One of the inhibitors is called the NRTI, the nucleotide reverse transcriptase inhibitor. The NRTI is used to force the HIV virus to utilize flawed nucleotides when building so that the virus cannot spread and infect more cells. Some specific types of NRTIs are ABC, FTC, and Zerid. Some side effects include headache, nausea, diarrhea, weight loss, and trouble sleeping. Another form of an NRTI is Comivir. This recent HIV medication was approved by the USDA in 1997. Comivir is a combination of two drugs, Retrovir and Epivir.